If you are unable to code prostate biopsy using the current guidelines which are published by AMA, watch this video until the end. In this video, first we will learn about prostate gland and what is the need for prostate biopsy. And also we will see what are the steps to code prostate biopsy. And also if you are looking to understand lower extremity revascularization procedures along with practical scenarios, please mention in the comment section as yes. Hence, I will provide one video related to lower extremity revascularization procedures as well as few example scenarios related to lower extremity IVR coding. And if you want to master prostate biopsy, watch this video until the end. If you want IVR coding example scenarios, please mention in the comment section as yes. And also after watching this session, if you feel this session will be helpful for you, please click on like button. So in order to understand new codes, we need to understand old codes related to prostate biopsy. We have three old codes related to prostate biopsy like 55700 biopsy prostate needle or punch single or multiple any approach, and 55705 prostate biopsy incisional any approach, and 55706 biopsies prostate needle transperineal stereotactic template guided saturation sampling including imaging guidance. So what is the problem with these codes are, whenever you want to code prostate biopsy, every time we have confusion about how to use the imaging guidance. Okay, so in order to reduce the confusion using the imaging guidance like 70,000 series, in latest prostate biopsy coding, imaging guidance is already included. We no need to code separately imaging guidance along with all these codes, which is the most significant development in the prostate biopsy CPT codes latest. So as we have discussed, now 55700 prostate biopsy any technique is deleted, which is in 2025, and also 55705 biopsy prostate any approach non-image guided. So for example, in the documentation, physician is performing prostate biopsy irrespective of the approach. If the physician does not use any type of imaging guidance, we need to use 55705. Okay, so previously in 2025, the code description of 55705 is biopsy prostate incisional any approach. Okay, so but in 2026 they have clearly mentioned the documentation does not contains any type of imaging guidance, we need to use 55705. And also in CPT, whenever we want to code any procedure, we need to understand the medical necessity. Okay, so basically what is the purpose of prostate biopsy? Mostly the purpose of prostate biopsy is to identify prostate cancer. In current CPT book, we have nearly 9 CPT codes related to prostate biopsy, which are very new to use. So we have 55707, 55708, 55711. So these are transrectal approach. So transrectal means basically physician will perform this procedure using the transrectal. Transrectal means through the rectum. So he will place the biopsy apparatus through the rectum. In transrectal approach, we have three codes: 707, 708, 7011. So what is 707? Biopsy prostate transrectal ultrasound guided sextant ultrasound localized discrete lesions. Okay, so here we need to understand what is sextant. Okay, basically in transrectal approach, the sextant means it is a systemic biopsy. Okay, where physician will take 6 samples from the right side and left side. So right side in 3 locations and left side 3 locations. So which is sextant. Usually this word you will see in the operative report, or otherwise directly they will mention 3 locations where physician will take the prostate biopsy. using the ultrasound localized discrete lesions. Okay. So where patient will take biopsies using the ultrasound based prostate biopsy. So these are the sextants of prostate. Okay. So left base, left mid and left apex. And right side, right base, right mid and right apex. So in sextant biopsy, patient will take biopsy sample from these 6 areas. Usually you will call it a sextant or systemic biopsy. So where this procedure is exclusively in order to identify the malignancy prostate. In 55707, patient will use only ultrasound. Okay. In 55708, biopsy, prostate, transrectal, ultrasound guided with MRI fusion guidance, first targeted lesion. Okay. So, in the purpose of 55708 is to take the biopsy of the targeted lesion. Okay. In this 55708, patient may perform sextant biopsy also, but the major important purpose of this procedure is to take sample from the targeted lesion or first targeted lesion. Okay. What happened in 55708? First, patient will take MRI fusion images and he will combine these MRI images with ultrasound. So that's why 55708 includes images from MRI as well as ultrasound guidance. If the patient uses the transrectal ultrasound first to targeted lesion, you need to use 55708. So exclusively for this code is for targeted lesion. So if the documentation contains any type of lesion, you can use 55708. Next we have 55711. So biopsy, prostate, transrectal, MRI, ultrasound, fusion guided target lesions only. First to targeted lesion. For example, if we see 55708, patient will take sextant biopsy as well as targeted lesion biopsy. Okay. 55711, if the patient takes only targeted lesion biopsy, okay, he will not take any sextant biopsy. So that time we will use 55711. So exclusively 55711 is for targeted lesion biopsy, which does not include any type of sextant biopsy, which includes biopsy from 6 locations of the prostate. So these 3 codes are related to transrectal approach: 55707, 55708, 55711. Okay. Next we have transperineal approach. So what is transperineal approach? So basically through the perineum, patient will create the incision and he will insert the prostate instruments through the skin. In transperineal approach, we have 3 codes: 55709, 55710, 55712. So if we observe these code descriptions, these are 100% not same, but only the approach is different. Among, for example, if we take 707, so what is different? 707 is transrectal approach, 709 is transperineal approach, except that everything is same. For example, if we take 55708, okay, so this is transrectal ultrasound guided sextant with MRI fusion guidance first targeted lesion. If we take 55710, only transperineal approach, only approach is different, everything is same. Okay. For example, if we take 55711, only this is for transrectal MRI ultrasound fusion guided targeted lesions only, first targeted lesion. So 55711 does not include sextant biopsy. But for example, if the patient performs same procedure using the transperineal approach, so we need to use 55712. So here what is most important, we need to remember 557072, 55712. We need to check the approach, whether it is transrectal or transperineal. Okay. So if you are able to identify in the documentation whether it is transrectal and transperineal, we can code prostate biopsy in very easy way. For example, if you want to identify transrectal, so you need to check in the operator report for keywords like patient will tell, I will place it the ultrasound through the rectum and I have performed the prostate biopsy. For example, if you want to code transperineal approach, so physician will tell, so I created the incision on the perineal area and I have inserted the ultrasound probe. So like that, you need to check the operative report for these type of keywords. Next, we have one more approach here, in-bore 55713, 55714, these two only basically. So here also biopsy prostate in-bore CT or MRI guided, sextant with biopsy of additional target lesions, first targeted lesion, 55714, biopsy prostate in-bore CT or MRI guided target lesions only, first targeted lesion. So here also basically in-bore is new technology related to prostate biopsy, but most of the time in USA physicians are not using this in-bore technology. So most of the time they will use transrectal or transperineal approach for this prostate biopsy. But here also, for example, if you take 55713 in-bore biopsy, where physician will take biopsy inside the CT machine. Okay, in-bore means inside the CT. So that time we need to use 713 and 714. So 713 is for sextant with biopsy of targeted lesion. Okay, 714 without sextant. So 714 is actually related to first targeted lesion only. And also, if anyone looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Our WhatsApp group link is in the description of this video. And also, if anyone looking for same day surgery training, IPDRG training, SCC training, CCS certification training, please send WhatsApp message to 707-526-3939. And one more important code we have is 55715, which is a add-on code. What is this one? Biopsy, prostate, each additional MRI ultrasound fusion or in-bore CT or MRI guided targeted lesion. List separately in addition to code for primary procedure. So basically, for example, in the documentation, if you see, so you can use 55715 along with the CPT codes where you have targeted lesion. For example, if we take 55708, we have first targeted lesion. If the patient performs another target lesion biopsy, you can use 55715. Okay. For example, 55711. So here also it is included first targeted lesion. For second targeted lesion, you can use 55715. Okay. For example, if you take 55710, here also it is included first targeted lesion. For second targeted lesion, you can use 55715. For example, if you take 55712, here also first targeted lesion is included in the code description. For second targeted lesion, you can use 55715. Like you can use in the same way for in-bore also. Okay. So like 713 also you can use for first targeted lesion, and second targeted lesion you can use 55715. Along with 55714 also you can use this 55715, as this 55714 is also included first targeted lesion its code description. So you can't use 55715 along with 55707. Why means this code description does not have a targeted lesion. Okay, and also you can't use 55715 along with 55709. Why means this code description is also does not include targeted lesion. So here we need to know the differences between sextant biopsy and targeted biopsy so that we can choose the correct code appropriately. So basically sextant biopsy is systemic biopsy. Okay, so targeted lesion biopsy is lesion based biopsy. In sextant biopsy we have 6 cores. In targeted biopsy, cores are not a valid term. So in targeted biopsy, patient may take multiple cores. In sextant biopsy, patient will use only transrectal ultrasound. Okay. Whereas in targeted biopsy, patient will use MRI plus transrectal ultrasound. So sextant biopsy is not lesion specific, whereas a targeted biopsy is lesion specific. So sextant biopsy is lower sensitivity to identify the cancer, whereas targeted biopsy is having higher accuracy to identify the cancer. So what do we need to understand here? Whenever you want to code this prostate biopsy procedure, we need to check whether physician is performing sextant biopsy or targeted lesion biopsy or both. So next keyword is whether physician is performing transrectal approach, transperineal approach or in-bore approach. Next, we need to check for imaging modality. So if the physician performs prostate biopsy without imaging guidance, we need to use 55705. If the patient performs prostate biopsy with imaging guidance, we need to code from 55707 to 55715. Next, we need to check modality. For example, if we take 55707 as well as 55709. Okay, so here patient is using only ultrasound. There is no MRI here, only ultrasound. If the documentation contains only ultrasound, you need to choose one among these two codes, 707 as well as 709. Next, you need to check type of biopsy, whether it is sextant biopsy like right base, right mid, right apex, or left base, left mid, or left apex. Or you need to check targeted from discrete lesion included in sextant biopsy if performed. So here is the total chart related to prostate biopsy. It might be useful for you in near future. So thank you folks. Thanks for watching this video. If you have still doubts, please mention in the comment section of this video.